For most people with hypothyroidism, taking a daily pill, levothyroxine, gets their hormone levels right back to normal. But what happens when normal on your lab report just doesn't feel normal? Today, we're going to dive into a real medical puzzle that affects a small but really significant group of patients who, even when they do everything right, still feel, unwell.
So, here's our game plan. We're going to unpack this whole mystery of persistent symptoms. We'll look at why the standard treatment can sometimes fall short, explore an experimental new approach, break down the super strict rules for trying it, see what patients are actually saying about it, and then wrap up with the final verdict on where this all stands today.
All right, let's jump right in with the core problem, and that is the deep frustration of being told your lab numbers are perfect when you feel anything but.
And look, we're not talking about just a handful of cases here. The guidelines from the European Thyroid Association tell us that somewhere between 5 and 10% of all patients on standard treatment, that's levothyroxine or LT4, are still struggling. Now, that might not sound like a huge percentage, but it translates to a massive number of people.
And these are not minor complaints, not by a long shot. We're talking about very real issues that mess with your daily life. The guidelines call out psychological distress, cognitive problems, that brain fog people always talk about, and just this general nagging feeling of not being well. This goes way beyond just the physical stuff.
And here's the central mystery, the real head-scratcher. Their doctors run the tests, the TSH levels come back right in the normal range, but the symptoms just don't go away. You can imagine how confusing and, honestly, how invalidating that must feel. So what gives? What is the disconnect between the lab report and real life?
Well, to get to the bottom of that, we've got to look a little closer at the hormones themselves, and why just replacing one of them might not be the whole story for every single person.
Okay, so this really breaks it down. Think of a healthy thyroid like a little factory. It makes two key products. T4, which is kind of like the inventory in the warehouse. It's the storage hormone. And then it makes T3, which is the active hormone. That's the worker on the factory floor, the one that actually gets the job done in your cells. Standard therapy only gives you the warehouse inventory, the T4, and just assumes your body's going to be great at turning it into the active worker, T3. For most people, that works out fine. But for some, it just doesn't.
So, why? Why does that conversion process fall short for some folks? Well, the research suggests it's a mix of complex possibilities. It might be that the T4-only therapy isn't getting hormone levels right in all the different tissues in the body. Or there could be these subtle genetic quirks that affect how a person's body moves and converts these hormones. The problem could even be tied to the underlying autoimmune disease itself. It's almost never one simple answer.
Because it's so complex, researchers started thinking, hey, maybe we need a totally new approach, one that tries to copy what a healthy thyroid does naturally. And that's where this idea of an experimental combination therapy comes in, using both LT4 and LT3.
The idea is actually pretty straightforward. Instead of just giving the storage hormone and crossing your fingers, why not give both? The storage hormone, LT4, and a little bit of the active hormone, LT3. But, and this is a huge but, the key word here is experimental. This is not a standard treatment you can just ask for. It's a very carefully considered trial for very specific situations.
And I really have to stress this point. The European Thyroid Association guidelines are crystal clear. This is absolutely not a first-line treatment. It's not something to be tried on a whim. Think of it as an option of last resort for a very, very select group of patients, and only after every other possible reason for their symptoms has been totally ruled out.
Okay, so you might be wondering, how does someone even get to try this? Well, the ETA has laid out a very clear, very cautious, and super strict set of rules. The process is incredibly rigorous. First off, the patient has to be compliant, meaning they're taking their LT4 meds exactly as they're supposed to. Check. Second, their TSH levels have to already be normal and stable on that medication. Check. Third, any other chronic health problems have to be sorted out. Then, if the symptoms still haven't improved for about 6 months and other related autoimmune diseases are ruled out, only then, after all that, can they even consider a trial of combination therapy.
And the trial itself? Wow, it's so precise. The dose ratio of T4 to T3 is carefully calculated somewhere between 13:1 and 20:1 to try and mimic the body's natural output. And they don't give the LT3 all at once. It's split into 2 smaller doses during the day. And it's not a long-term commitment right away. It's just a 3-month trial to see, hey, Is this actually helping?
And you can bet the monitoring is just as strict. Blood work is done after about 2 months, and it's always done before the morning dose to get a really clean, accurate reading. The goal isn't just a normal TSH either. They want to see normal levels for TSH, free T4, and free T3. But the most crucial point is this. This has to be managed by a specialist, an endocrinologist or an accredited internist. This is not something you do with your family doctor.
Okay, so that's all the nuts and bolts of it. That's the how. But the big question is, does it even work? This is where things get really interesting because we're shifting away from the clinical protocol and focusing on what really matters, how patients actually feel.
Okay, get this. This part is fascinating. When researchers looked at a whole bunch of different studies, a really consistent pattern popped up. About half, 50% of the patients who tried both therapies clearly said they preferred the combination treatment. Even if their lab numbers didn't change dramatically, their personal subjective experience was just better. And that's huge.
So why did they prefer it? What was actually changing for them? Well, the data shows improvements pretty much across the board. People reported better quality of life, better mood, less anxiety, clearer thinking, basically a reduction in all those nagging hypothyroidism symptoms. These are the exact problems that the standard therapy just wasn't touching for them.
And in some of the trials, the results get even more specific. We're talking about patients on the combo therapy showing statistically significant improvements in their depression scores. They had a measurable drop in psychiatric distress compared to the folks just on T4. This really hammers home that for the right person, the benefits can be profound, truly life-changing.
All right, let's bring this all together. After looking at all this, what's the final verdict on this LT4 and LT3 combination therapy? Where do things stand?
Okay, here's the bottom line. First, it is still an experimental approach, not a standard of care. Second, it is only for a very small, very specific group of patients who meet all those strict criteria. Third, and this might be the most important part, success here is ultimately measured by how the patient feels, their well-being, not just by what the labs say. And finally, it absolutely 100% requires the close supervision of a specialist.
And just as a little extra context, it's worth knowing that this active T3 hormone, liothyronine, has other legit uses in medicine. It's used in very specific situations for thyroid cancer patients getting ready for radioactive iodine therapy. So while using it this way for hypothyroidism is experimental, the hormone itself is not some new unknown substance. Endocrinologists are very familiar with it. And that leaves us with a big final question to chew on. This whole issue just screams that the one-size-fits-all approach to medicine doesn't always fit. So as we get smarter about genetics, about our individual biology, you have to wonder, could these kinds of highly personalized, carefully monitored treatments be the future? Not just for hypothyroidism, but for all sorts of chronic conditions. It's definitely something to think about.